To begin the cardiac exam in the right side short axis view, the transducer is held with the transducer index facing the patient's head, the thumb on one side of the transducer, and 3 fingers on the opposite side of the transducer. The elbow of the transducer arm is anchored to the rubber mat on the exam table. The index finger is anchored to the patient's body, and the transducer is anchored to the index finger. This helps prevent image drift on the ultrasound screen. The transducer can be held in the left hand or the right hand. If the transducer is held in the left hand, the ultrasound machine and the sonographer's position are reversed. The position of the transducer on the patient's body remains the same. Older cardiac transducers were usually a microconvex type, which allowed greater mobility, but often would not give good color flow imaging. Newer cardiac transducers are usually a phased array type, which have a flat head and greatly limit the types of movement that can be made. Ultrasound manufacturers design the transducers for humans. The anatomical shape of the thorax is different in animals, and the human transducers limit mobility for obtaining the best cardiac image. Every transducer has an index marker which indicates the direction of the ultrasound beam in B mode. B mode is a two-dimensional image. Phased array cardiac transducers produce a wedge-shaped ultrasound beam like this. You will use the transducer to move the ultrasound beam. The ultrasound beam is like this beam of light, relatively long from the front of the transducer, or index, to the rear, but very narrow from side to side. There are 4 methods of moving the ultrasound beam: sliding, angling, fanning, and rotating. I will have a red arrow attached to the transducer to show the direction of the index of the transducer. This will help demonstrate and emphasize these transducer movements. Compared to abdominal ultrasound, movements made in cardiac ultrasound are very small. In this movement, the transducer slides from one location to another location on the patient's body. The transducer is usually held in a fixed angle to the patient's body. In cardiac ultrasound, these sliding movements are very small. Angling is performed from a point of fixation on the patient's body. The tip of the transducer does not change in location. Angling is a forward or backward movement of the transducer from the point of fixation and along the plane of the index indicator. When angling forward, the ultrasound beam moves toward the direction of the index indicator. When angling backward, the ultrasound beam moves away from the direction of the index indicator. In cardiac ultrasound, angling movements are very small. Angling is very limited with a phased array transducer because of the flat head. If you angle too much, the head of the transducer breaks contact with the patient's body and the image is lost. Fanning is performed from a point of fixation on the patient's body. The tip of the transducer does not change in location. Fanning is a side-to-side movement of the transducer from the plane of the index indicator. When fanning cranially, it is the ultrasound beam that moves cranially. In cardiac ultrasound, fanning movements are very small. Fanning is very limited with a phased array transducer because of the flat head. If you fan too much, the head of the transducer breaks contact with the patient's body and the image is lost. Rotation is performed from a point of fixation on the patient's body. The tip of the transducer does not change in location. The transducer rotates clockwise or counterclockwise without changing the transducer angle or point of contact with the patient's body. Rotational movements are most commonly used to change from a short axis view of the heart to a long axis view of the heart, or about a 90-degree rotation. Throughout the ultrasound procedure, the tip of the transducer should be in firm contact with the patient's body, but pressure should not be used. The patient's ribs yield very little to pressure, and the force of pressure makes the patient very uncomfortable. An uncomfortable patient will begin to squirm and make your job much more difficult. The patient will most likely try to get away and may even resort to biting or scratching. In addition, if you apply too much pressure, you are likely to actually lift the patient away from the cardiac table and cause the heart to be physically displaced from your point of contact. In cats, pressure can compress the heart and cause a murmur or flow disturbance. When having difficulty acquiring a good cardiac image, many sonographers will unconsciously begin to apply more pressure. Resist this impulse. It does not help. Tips are to use more ultrasound gel, adjust the position of the patient, adjust the transducer position, and make sure enough hair has been shaved from the point of contact. Remember that we must look between the ribs to see the heart. The ideal transducer location is halfway between two ribs. If an acoustic rib shadow is directly in the center of the right side short axis cardiac image on the ultrasound screen, you need to slide a tiny distance cranially or caudally to the rib causing the shadow. Then you need to angle a little caudally or cranially. If you slide cranially, you angle caudally. If you slide caudally, you angle cranially. Your movements may only be 1 or 2 millimeters. You may only angle 1 or 2 degrees. These are very small movements. In the right side long axis view, achieved by rotating 90 degrees clockwise from the short axis view, you may need to slide 1 rib space cranially or caudally, or slide 1 rib space dorsally or ventrally. You will also need to fan or rotate the transducer slightly to see between the ribs. A common problem in ultrasound is the difficulty in maintaining an image in a stable position on the ultrasound screen. Initially, the cardiac image will be in the center of the screen and then slowly drift off to one side and keep moving off the screen. Everyone does this. The sooner you learn to prevent image drift, the less frustrated you will be. If the cardiac image is drifting, it is because you are unintentionally moving the transducer. The best way to prevent image drift is to anchor the elbow of the transducer arm to the rubber mat and anchor the index finger of the transducer hand to the patient. Then anchor the transducer to the index finger.